All right, a very good morning to you. Happy Monday and happy new week. I hope that you've had a better start to the day. Welcome to the show. My name is Winnie Lubembe, and of course, the show is Your World. And today we want to talk about something that's very important, something that, again, we need to talk about every single day. And this is all about gender equity. And of course, it's all about the digital revolution and what we're doing to foster equitable systems. And of course, this is across border, all right? Because as we all know, gender equality remains a significant issue in Kenya and across the globe as women and girls continue to face various forms of discrimination that increases their risk of gender-based violence and harmful practices such as female genital mutilation and child marriages. And barriers to education and employment also hinder women and girls' ability to fully contribute to the country's development agenda. And of course, like we said, not only in the country but also across the globe. So what exactly are we doing to sort of, bridge the gap and bring equity as far as gender is concerned? Well, that is what we want to find out in today's conversation, so you want to stick around until the end of the show. If you have a question, you know the drill by now. At NTV Kenya, both on Facebook and on Twitter, is how you can reach us, and tag me as well at Lubembe_Winnie, so that by the end of the conversation we know, or we have a better understanding as far as why this is very important, and of course also the inclusion of men and boys as well as in the fight. And this is as far as equity is concerned. But before you meet my guests for the day, both of them have actually more than 25 years of experience, so really perfect persons to have this conversation. Let's take a look at the numbers. What exactly do they say? This is as far as addressing some of the inequalities that are around. So when it comes to the gender inequality, and of course in numbers, women let's start with a global aspect, right? Where globally 1 in 10 girls miss a class or drop out of school entirely, and of course underline the word entirely, and this is due to menstrual periods, all right? And at the same time, women in Kenya earn 32% less than their male counterparts, and 4 in 10 women aged 15 to 19 years who have not been to school have ever been pregnant. And of course, this is according to the KDHS statistics of 2022. And then this continues, to say that 34% of women in Kenya aged 15 to 49 have experienced physical violence in their lifetime. And at the same time, 4 million women in Kenya have undergone female genital mutilation, and an estimated 574,000 additional Kenyan girls are at risk of undergoing FGM. And this is between now and 2030 if nothing is done to actually fight the same. So the question is, so what exactly are we doing? And of course, just last week we celebrated International Women's Day, and of course still following the theme, and that is digital innovation and technology for gender equality. How then can we harness the power of innovation, of course, in this digital era, digital space, just to make sure that we have some level of equity and equality as well. So to help us with that conversation, like I said, perfect persons to hold this conversation given their extensive years of experience. So we have Mr. Anders Thompson, who is an UNFPA representative, and this is in the country, that is Kenya. It's so good to have you this morning. How are you doing?
Thank you. I'm doing well. Thank you very much.
All right. And of course, thank you so much for sparing your time as well. And we also have Dr. Asha Mohammed, who's the Secretary General, Kenya Red Cross Society. So good to have you this morning. How are you feeling?
Fine, thank you.
All right. Both of you have like some sort of memo. You have some bread going, and Mr. Thompson has some bread going. And I'm like, okay, where's mine? But it's so good to have you both. Karibuni sana to the show. And I'm just going to start with you, Dr. Asha. Looking at those numbers, what exactly do they tell you?
Thank you very much for this opportunity and for having us this morning. Sometimes I say I don't like to see these numbers because they're depressing.
Yeah.
And I always say it's also not just about the figures themselves, but I always try to imagine the individuals behind it. And for me, then coming from a perspective of saying one lost is one too many. Because when you look at some of these figures and you imagine the number of people that would depend on this one woman or one girl in the future, it's a whole community that you're looking at. So these numbers unfortunately always hit us, and is a stark reminder that we still have a lot to do.
Absolutely.
Yeah.
Have a long, long way to go, as far as that is concerned, which sometimes I usually say it doesn't necessarily have to be a long way to go, right?
Yeah.
There's some things that we can do immediately just to make sure that we change things. All right, Mr. Thompson, what do those numbers say to you?
Yes, first of all, thank you very much for having us and for having this discussion on a Monday morning with all Kenyans out there. I mean, it's really very important. And yes, of course, it shows that we still have a lot of work to do. We celebrated, as you said, International Women's Day just last week, and of course on the 8th of March. And of course, people debate whether you should say Happy International Women's Day or have we even come far enough to celebrate
say the word
it, right?
happy, yeah.
The point is that International Women's Day probably started 100 years ago when women were fighting to get equal pay. And even today, that fight goes on.
Yeah.
And I think it's only 38% of women in Kenya who make the same amount of money for the same job as men. So you see, even in that divide, in terms of the access to money, access to resources, there is already a big difference. And that translates into, as you said, opportunities in terms of education, schooling, jobs, what they can do in terms of realizing their dreams. So it is true, as Dr. Aisha was saying, it's the women behind that we have to look at, and there we have a lot of work to do still.
Absolutely, absolutely. I mean, and despite the fact that the numbers can be a little bit depressing, I think we can appreciate the fact that Kenya has made, some bit of progress, and this is as far as closing, the gender gap. But again, in the times of crisis and emergencies, women and girls, continue to suffer the most, as compared to their male counterparts. So the question is, why is this the case?
Yeah. No, you're right, and I think we can even use the example of the current drought we're experiencing in this country, and we see that women and girls are disproportionately affected. Why this is the case, I would want to say that first of all, you're starting from, a baseline before the disaster even happens. Okay. So unfortunately, women and girls are already vulnerable today for many reasons. And when a disaster strikes, it finds them in a situation where it would take them, much more to actually get themselves out of that situation. So it only makes it even more difficult for them. Secondly, I would say it's also about what resources they also have with them to be able to respond. And many times you see that when a disaster happens, it's easier, I would say, for the men to really, pick up themselves and quickly move on to the next level or to seek assistance. And many times it's the women and girls who are left behind. And we've seen this even with the drought. You go to some of the communities, especially in the far-flung counties, where then the men have had to go away with the livestock to look for water and pasture. Who is left behind? It's the women and the girls. They have to take care of the home. They have to take care even of the weaker animals that could not go with the men. But they've been left with nothing as well to actually take care of these animals. They're the ones who have to trek the many kilometers to actually go and fetch water. And in the process, they're exposed to a lot of risks, and we see an increase in sexual and gender-based violence. So I think the baseline in terms of where women are today, because the impact of a disaster on an individual also is dependent on the resilience of that individual. So if the individual is not as resilient, then it means they will suffer more. And this is really where women and girls find themselves, that they are not resilient enough to be able to actually bounce back after they are confronted with a crisis.
Absolutely. And majority of the times, I mean, look at what is happening, and especially in the volatile, North Rift area, where, and we had this yesterday, where there's some people or, communities that are actually using women and girls as shields, which is just sad to hear about. But Mr. Thompson, very quickly, majority of the times when we have this conversation around gender and women and girls and how they're affected, and especially when it comes to like disaster, climate change and all those things, there's usually like a push and pull, where a lot of people would say, but even the men are affected, as we continue to say that women and girls are mostly affected. So then in terms of painting this picture so that people really clearly understand, when we say that women and girls suffer more, this is what we mean, or this is how we quantify this thing? What would you say?
No, you're absolutely right. When disaster strikes and we have drought, I mean, everybody suffers.
True.
Everybody in the family, the men, the women, the elderly, the young children. But when we say the women suffer more, I will give you some examples. It comes down to the power balances in the family.
All right.
And when you have that external stress, the ones who have the most control are the ones who will win out. And those are usually the men.
The men, yeah.
So they can make decisions that can adversely impact the girls in the family or the woman in the family. Let's say a woman is pregnant and now she has to get a little bit of money to go to maybe have a C-section at a nearby hospital, which is not so near, maybe it's 2-3 hours away,
yes.
and you don't really have money, you only have a few hundred shillings. Are you going to immediately say, yes, let us spend the money on the transport, or should we wait? So even there you can have a decision that can adversely affect that woman.
All right.
Or the girl in the family. We don't have money, we're all suffering, we don't have water, the livestock have perished. Now they may decide to take the girl out of school, not the boy. They might decide that girl needs to marry early.
Yeah.
And that will have an impact on that girl's life for the rest of her life.
That's true.
So that's what we really are talking about.
All right, and I see that, and of course the question might be, so then how do we harness this power that most men have in, you know, different communities and of course in different setups as well, just to make sure that we have sort of a concerted effort in terms of promoting equity in this, and so that we're not only talking about women alone and girls and also just the men alone. We have, you know, sort of like a united front as far as this is concerned. But before we talk about that, let's also address something else. And this is still in, you know, the reproductive health and rights, right? Because again, at the end of the day, going back to 1994, where of course Kenya, you know, alongside 178 other governments adopted the program of action, and this is of the International Conference on Population and Development. So the question is, how has Kenya fared, you know, in terms of advancing some of these goals as far as the ICPD program, you know, of action, and this is in ensuring that we secure the rights and dignity of women and girls. How are we doing?
I would say, first of all, I mean, there's a lot to celebrate in Kenya.
Okay.
And if you look at Kenya, it's a beacon of hope in East Africa, I would say almost all of the continent.
All right.
Kenya has implemented some very, very ambitious laws, regulations, and so the whole legal framework is really there in place, and that is something that many other countries are looking to implement. So Kenya has come a very, very long way. Of course, it's always when it comes to implementation that we see inertia, but in some places, and particularly in those counties where you have a little bit more wealth, those laws have actually been quite successful in their implementation. You see in those counties that are lagging behind economically, that's also where we are struggling to implement those same laws. So it comes down to economic opportunity as well. But Kenya has made a lot of strides ahead. And I think actually Kenya is trailblazing when it comes to the implementation of laws in terms of access to health, in terms of FGM. It is illegal, which is not the case for many neighboring countries. When we talk about enrollment of girls in school, despite some of the dropouts that we see caused by the drought and other emergencies, Kenya has come a long way.
All right, so there's a bit of progress.
To add on to what Anders is saying, I think Kenya has, you know, done very well on a lot of aspects. I think one of the challenges I see is that we probably are not consolidating enough also some of this data and information, because when you go to the ground, actually you'll find that there's even much more that's happening at the very low level. So how do we ensure that even as a country we are able to ensure that all that is captured? Because I believe if that is the case, then we will actually be able to see quite a lot of progress and maybe then be able to narrow down in terms of exactly what needs to be done to really accelerate. So I think there's quite a lot that sometimes you feel is not captured at the national level. And that's a gap, I think, that needs to be addressed.
Data has always been an issue. So then how do we harness, because there's usually a lot of talk around public-private partnership, which is a good thing, because at the end of the day, we need to consolidate, all these efforts just to make sure that, number one, we have data and accurate data, and also number two, find ways that then we can close these gaps and, find ways that we can find solutions. So then how do we harness that? Understanding how important, first of all, public-private partnerships are, and how do we harness that? Because sometimes we tend to, governments will tend to work on its own, and then institutions tend to work on itself. Non-governmental organizations also tend to work by themselves.
I think it also then boils down to the framework that we have in the country and how people feed into this framework. And now let's say Kenya is not short of tools and frameworks for a lot of things. Our challenge, as Anders was saying, it's always how we implement or how we use it. And so how does every sector feed into this one framework to be able then to ensure that it all comes together? Because you find that yes, private sector may have their own platform, civil society have their own platform, government has its own platform. So how do we bring all that together? And it actually boils down not only just having the framework and tools, but really putting in place some coordination mechanisms and bringing all the players together. And I think that there's a lot of attempts to do that, but sometimes there's also the challenge of what captures the other parties' interests, in, so to speak, because sometimes I hear people complaining that this tool does not capture maybe what I'm interested in. So how do we ensure that we all come together and have the indicators that then cut across and speak to
like
everyone? Exactly, a common ground.
All right, I see that. Earlier on, again, Dr. Asha mentioned a question of resilience and how resilient a society or a community is will sort of like help in terms of, understanding and fighting some of those things. So then how do we build resilience? Because both Red Cross and UNFPA are very, very hands-on on the ground. So I'm pretty much sure you know exactly what is happening and the picture, on the ground exactly. So then how do we build resilience, and especially amongst communities?
No, that's an excellent question. I just wanted to comment on what Dr. Aisha was saying about the private sector and the involvement there. I think when we can create win-win situations where it's a profit for the private sector, it's an opportunity for the private sector, and it still at the same time helps women, then we are really in good shape. It was very interesting before the Commission on State of the Women, where a large delegation of Kenyans went to New York. They had prepared a report, and that report said that for women, the advent of M-Pesa in Kenya was really a game changer for them, because it allowed them to have access to money and do small business and things like that. At the same time, this was a business opportunity for a private enterprise. So we can marry those two things and make it an opportunity. And I have other examples we can come back to maybe later. But on the resilience, I mean, it's very tough right now to really talk about building resilience, because we're definitely in the north with the drought, the severity of the drought. It's really hard, because when you see all the livestock that has perished, and then even if the rains come in the next month or two, that livestock is already gone. So the communities are very, very vulnerable, and the normal coping mechanisms that they have are largely gone. So it really has a multi-year impact, even if hopefully the rains are going to come now. But there is a lot that we can do, and I think in partnership with Kenya Red Cross, we are working in a very targeted and very deliberate way to not only respond to emergencies that are at our doorsteps now, but really to look at it as a development endeavor, that we have to go in and build strength in communities, so that when that shock comes they're able to stand on their own legs and really and bring solutions to their own lives. So that's what we're trying to do in so many communities and counties across the country.
Absolutely. There's also another conversation where people were saying, listen, sometimes people just need food. Let's just start from there, right? At the basic level, they just need food, they need water, before we even talk about some of the long-term measures that we can take just to make sure that we do not have a repeat of the same. And of course, in terms of emergencies, yeah, we're not prepared for the same, but we'll talk about that, disaster preparedness. But then again, for something that has been happening year in, year out, for example, drought, it's not a new phenomenon. We've always dealt with drought. So then how do we make sure that we mitigate the impact of drought, and especially to women and girls, you know, who are really, really suffering the brunt? So I think we'll talk about then, so where do we start now, and then how do we build short-term and long-term goals as well, so that's come, what, 3 years from now or 5 years from now, we have a totally different conversation altogether. But we're about to take a break, and of course when we come back, we'd also want to understand, so fine, and of course, in relation to the theme that is International Women's Day, which is digital innovation and technology for gender equality, how then do we harness the power of the same, that is innovation, as well as, you know, the digital space is concerned? We find out after the break. But like I said, if you have any question or a comment at NTV Kenya, both on Facebook and on Twitter, is how you can reach us, and tag me as well at Lubembe_Winnie. So there's still more to come on the other side of the break. Stay with us. This is your world. All right. Yeah. All right. Of course, the conversation continues even during break. So welcome back. The show is Your World. And of course, it's all about the digital revolution and what we can do to foster equitable systems. And of course, yeah, we're just talking about what is happening, the humanitarian crisis. And again, what can we do to sort of like help, you know, soften the situation, because there's a lot that is happening. People have been told to move out at exactly 8:30, actually right now, to move from now, you know, so that the operation, you know, continues. But people are dying and all those things. So again, what are some of those things? What are some of the causes, the deep-rooted issues that are affecting our communities? But we're also trying to understand how then do we bring about the whole question about equity and equality as well. And to help us with the conversation, we have Mr. Anders Thompson, who is UNFPA representative right here in the country, as well as Dr. Asha Mohammed, Secretary General, Kenya Red Cross Society. And like I said, both of you have like over 25 years, you know, of experience in different fields. For example, Mr. Anders, for you is mostly in development and humanitarian assistance, and of course with a commitment to promoting human rights, reproductive health, as well as poverty reduction. And of course for Dr. Asha as well, diverse experience in working within humanitarian and government institutions. You've worked in several countries as well. My question is, what is that one or two or three things that is sort of like common? It doesn't matter whether it's here in the country or, you know, in Somalia where you are, or in Palestine. You know, what is that one thing that women and girls continue to face that is pretty much common, so that even as we talk about equity and equality and all those things, we're cognizant that this is not only an issue, you know, in the country, but across the globe. Do you understand, Dr. Asha?
Yeah, I think for me it's really the question of, first, the inadequate opportunities for women and girls.
All right.
And secondly, it's also about the question of capacity. And that's why even as the Kenya Red Cross, we are really concentrating on building capacity of women and girls even in the tech area, because yes, Kenya, I think, is also again one of, you know, those countries that can be considered, of course, a tech hub. But how many women and girls in Kenya actually have access? And access could mean that there is a space where they can actually go and have access. But secondly, it's about the actual technology, whether it's the mobile phones or otherwise. And then thirdly, it's also capacity, because you can have the access in terms of space and the equipment is there, but do they know how to use it? Do they have the skills? So this for me are really some of the basic fundamental issues that I see cutting across the different countries. And so any intervention that you know would need to elevate women and girls in this area would actually need to tackle at least these three basic questions.
Absolutely.
Yeah.
All right, Mr. Anders?
No, I mean, of course, Dr. Asha had to steal my answer. You know, lack of opportunity. But I think, no, behind that joke, there is really a reality. That is really what it's all about, right? And when you look at the data we were talking about, that we have such great data in Kenya from the National Bureau of Statistics. But what we see in many counties is that teenage pregnancy is very, very high. And it's actually on the rise in some counties. There are counties where more than 50% have had their first child as a teen, as a teenager. And what does that mean? It has a direct impact on opportunity, because usually you'll drop out of school. Even if you manage to stay in school, you cannot do your schoolwork as well. You will not have the same job opportunities if you don't have or for long-term education. If you don't have those job opportunities, the job you will get, if you get one, the life income that you will realize over your lifetime will be much less, right? So you're on a negative trajectory instead of a positive one had you been able to stay in school. And all of that also, just to say that also translates into the opportunities in the digital space. The opportunities or lack of opportunities are not so different from the real world to the digital world. Right? The mechanisms behind are some of the same.
Yeah, absolutely. So then where do we start? Because like we said, yes, we can talk about, harnessing the power of, the digital space and innovation and technology as well. But access, I mean, is a very big issue for so many women, and girls. So the first question will be, so then where do we start, first of all, before we even talk about, fine, it is good to have like your businesses and promote it, or use technology to improve, your businesses and anything else. Where is the problem, first of all, and where do we start from?
I think it's again an equity issue.
Okay.
That's where I would take it. Because at the end of the day, you will find that yes, there are those areas or those categories of people that will continue to advance in that particular area. So today you say, oh, Kenya is a tech hub, and there's so much. But then when you look at what is the the part of the population that is actually there and really doing well with this, and how about the rest of the country? How about the rest of the people? Like Anders says, in some of these counties, you go and you would wonder, are you in the same country? So I think for me, it's really a question of understanding exactly how the picture looks like, and again, borrowing from the UN in terms of saying, you have to look at the farthest behind, so that you're not leaving other people behind, because you can continue to advance, but you'll only be advancing with a small proportion. But you need a critical mass to actually make that change, and that critical mass is actually, I would say, the women and girls that are still left behind, whether it's all the way from the school area, and now of course we have for example, computer literacy in a lot of schools. So if the girls are not going to school, where will they learn about computers and how to use computers and the benefits of some of these issues? So I think it's important to look at where we are, farthest behind, as opposed to working and only just continuing with, yes, we have this, now we want to increase it, forgetting that that is continuing to increase the gap. And so, of course, the equity question can never be solved, because the gap will continue to widen, and there'll be many, many more actually that will be left behind. So I think for me, this is really critical. And then, of course, once that's clear, what exactly is needed to actually ensure that we close this gap? Is it an issue of access in terms of the technology itself, or is it an issue of access in terms of capacity? And that's where then some of the programs in building capacity and skills of women and girls to be able to actually benefit from those opportunities, because yes, maybe sometimes opportunities could be there, but are they able to access it?
I see that. And coming back, because I'll come back to you to understand, so fine. Understanding that, what exactly is Red Cross doing, and especially when it comes to harnessing the power of innovation technology, and of course in this digital era, what exactly is Red Cross doing? Because you're very hands-on, and it's the same thing as UNFPA, but then again, when it comes to this tech side, what exactly are you, employing just to make sure that we also help these communities? But coming back to UNFPA, and of course, what exactly it's geared to, and this is in very three transformative areas, right? Ending the unmet need for family planning, ending preventable maternal deaths, and as well as ending gender-based violence and harmful practice such as fetal genital mutilation, and as well as child marriage. So how exactly then is UNFPA harnessing the power of tech just to make sure that, you know, you reach your goal, and this is in these 3 transformative areas?
Oh, thank you very much for the question. It's interesting because we sometimes see that this digital revolution is a panacea. It can solve all our problems, and definitely it will, and it can solve many problems. But there are certain things that you cannot do virtually or remotely, or, for example, childbirth.
Yeah. You have to be in a facility.
You have to be in a clinic.
Yes.
You can't say if you are 3 hours away, you don't have the money to get to the clinic that I can do it remotely, right? I mean, it sounds, but it's the reality. So there are certain areas in which we have to continue to invest. One of them is in sexual reproductive health, maternal health, having the ability to accommodate all women, no matter how rich or poor they are, where they come from, and so on, right? But what we can do is we can use the technology to make sure that she actually arrives at the clinic. We talked about M-Pesa. We have M-Pesa. Let's say a woman goes to the local clinic and she needs a referral right now to save her own life, but to go to a hospital 3 hours away. If we can make sure that that midwife or nurse who is attending to her has a kitty on M-Pesa, an emergency kitty in a way that she can have access to and say, okay, now you need to go, and she can get a taxi or an ambulance, and she can pay right away. Then we have solved the problem. When she arrives at the clinic, not all clinics have the most high-level experts and so on. But if we can have, for example, mobile scanners where the imagery can be sent to Nairobi or Kisumu or where it might be, people can say, yes, we have a breech presentation, and they can over the phone instruct the health personnel on the ground on what to do. Then we can save lives. So that's how we see it. We have to marry the real world with the digital world to get results.
Absolutely. And also understanding how to use, you know, this tech sometimes is a big issue for so many people. I'll still come back to you to really understand. So then how exactly is UNFPA, you know, employing that? But Dr. Asha, let me come back to you, because amongst the you know, the Red Cross and of course the agenda, what you do, and of course your foundation are 3 pillars, but of course disaster management, you know, is one of them. And you endeavor to employ practical and innovative results-oriented solutions. So I want to understand this practically, you know, results and innovative results-oriented solutions, and what exactly you're doing, and especially when it comes to the disaster preparedness, you know, aspect of the same. How are you leveraging, you know, technology and innovation as well?
No, thank you very much. Yes, and for Kenya Red Cross, innovation is actually, you know, one of our key pillars in what we do today, and also coming from the realization that even within the disaster space, it keeps changing, the environment is changing, the kinds of disasters are also changing, the severity is changing, which means we have to also continuously try to find better ways of actually doing disaster management, so to speak, whether it's preparedness or even response. So we have, you know, a very vibrant innovation space in the society, where today we have 2 functional labs, one in Lamu and one in Mombasa. And looking at starting one in Turkana, where then, especially for young people, bringing them to this space to be able to learn, but more importantly to bring out also their creativity and use that also in terms of building skills, but also empowerment and entrepreneurship, so that they can even be able to generate income for themselves even as they continue to work for the Red Cross. But in terms of disaster management, what we do also frequently is we have we bring together, you know, some young people. The other day we brought together some women in the form of either it's a hackathon or a mapathon to really say, okay, these are the issues that we are having in our disaster management. Can you help us find a creative solution or an innovative solution on how to deal with it? And it's amazing the kind of things that actually they are able to bring out, especially using, of course, technology. Recently, when we had the earthquake in Turkey, we had Kenya Red Cross staff and volunteers actually closed up in a place for several days, just helping in mapping of the disaster areas in Turkey, and you can see then how much technology can make a difference. Because some of the people on the other side are very busy responding. They do not maybe have time to really look into the details of some of that, and that is a resource that actually we can help. And we do the same even for ourselves using drones. Today, a lot of assessments as well we do using drones, because more and more, sometimes it's very difficult to access. Give you an example, when we had floods a few years back in 2019, some of the areas were completely inaccessible. But using drones, we could be able to assess and see what is the impact, what is where are the populations that have been affected, and again using then with our partners like Airbus Foundation, we're able then to go and actually drop food using helicopters, because then we could tell that yes, there is a number of people in a certain place in this locality. So I think it is really helping, and it's really the way to go. Yeah.
I see that. I see that. And of course, for UNFPA, again, and we see this online on Twitter, UNFPA is really doing really good, especially helping with what is happening in Syria in terms of like, sourcing for funding and all those things, just to make sure that people get help. But coming back to the country, and especially when it comes to the whole question on sexual and reproductive health, like you said very well, there's some communities where there are no, health facilities close by, or sometimes people might not really know their rights, right? Including what we're talking about, and that is make sure that, we prevent maternal deaths, cases of gender-based violence where you can actually report, and get justice for the same. So when it comes to harnessing, the power of innovation, what have you done so far? What has worked so far?
Excellent question. No, we have done many things, but so I'll just give you a few examples.
All right.
Like Dr. Asha was saying, like Kenya Red Cross, I mean, in this development humanitarian space, I think resources are getting scarce.
Yeah.
So we have to stretch every dollar that we get, and we can do that by intelligent use of technology. But sometimes it's not about just inventing a new thing, right? It is really about using existing and proving methodologies in a new intelligent way, right? So let me give you an example. How we're doing in Western Kenya right now, targeting 300 clinics in 10 counties where we want adolescent girls to come to the clinics to be tested for HIV. That's very high in that region still. We want them to come and learn about family planning and so on, right? But a lot of the challenge is the quality of service, and people don't want to go to the clinic, right? So we are using a methodology that is well known in the streets of any big city in Kenya, the Uber app, so when you have a driver, you will give them 5 stars. If the service has not been good, they will get less. And they can also give stars for the client, right?
The client as well, too.
So what we are trying to introduce, and we are actually doing right now, is a system. We are partnering with another organization who have a lot of experience in this, that allows clients to come to the clinic. They can rate the service. If it is consistently a 5-star service, that clinic will get an incentive from us, thus increasing the level of quality that is provided. And because of these girls are vulnerable and there are barriers for them to go to the clinics, they also get what we call TICO points that they can use for some small purchases, for hygienic pads, for example, other things that they still need. So we are creating a system using a technology and methodology that is already proving to improve healthcare in remote areas in Kenya.
Absolutely, I see that, and of course it's important because we usually advise, like, especially for women, pregnant women, please go to a facility. But then again, you go to a facility and you get substandard, quality of service. That is not something that we're aiming for. So that's interesting to see. Okay, so then what more needs to be done in terms of both your organizations? Yes, you have done things that have worked. What is it that needs to be strengthened? And of course, also working in collaboration, like I said, with like government entities or even amongst each other. Where are some of the areas that you have identified that you see, what, we actually need to strengthen this area and that area, so that, we have equity and quality as well, which is very important.
I think for me, if I start, there's the whole issue about how gender sensitive our humanitarian work is. And this is really still a very big gap that many times it's almost like we just have to put some add-ons onto exactly what we're doing. Yeah. And again, not because Anders is here, but thanks to UNFPA that the Kenya Red Cross is able to bridge some of this gap because, for example, the traditional response kits, and this is also a global issue, not just in Kenya. Yeah. It is designed in such a way that it does not take care of the needs of women. So talk about the basic issues of sanitary towels. When people are displaced, then where do you expect the women and girls to actually go and get this? And it's not part of what is given as part of the response package. Yeah. But we, in our partnership with the UNFPA, we are able to actually have this as an add-on, and not only for the women and girls, but also for the boys as well. So we find that our disaster tools are not responsive enough, and therefore there is definitely need to ensure that these are reviewed and take into account these populations. I'll give you another example. When you have people displaced and they have to be put in camps, of course not something that we like to do, but sometimes it's inevitable. Even the designing of these camps sometimes put women and girls at risk. You put the toilets and bathrooms a bit far. Very far from where the rest of the population is. So you can imagine them accessing then these facilities, of course puts them at risk of sexual and gender-based violence.
Sometimes there are no lights.
Exactly. There are no lights and lights. So I think we need to be a bit more sensitive in that sense, and therefore design our response tools and frameworks to ensure that they actually take some of these issues into account. So for me, that is maybe one of the things I would really flag that we still have some work to do in that particular area.
Absolutely. All right, Mr. Anders?
Yeah, no, I mean, just taking a step back, I'm very encouraged by the new government's ambition to digitize all services. I was giving an example before how we are reaching out in Western Kenya to young women and using sort of that rating technology to increase access but also quality. I think that can be done for anything, any clinic, for any service across the country, something similar. There are a lot of opportunities when we talk about resources reaching the front line. Sometimes there are stockouts, but in another place you have stocks. Or there are commodities that are about to expire. We need to be able to have that digitized so we can optimize the usage of all our resources. So I think at many different levels there should be a lot of opportunities. I think it's also important to have stimulate a little bit of competition. Why not have Kiambu compete with Wajir? Maybe Wajir will come up with the best innovative solution if they are given a little bit of money, some seed funding to come up with some digital solutions to help these citizens right there on the front line where life is really tough.
Yeah, and they usually say the communities actually have the solutions. If you talk to them very well, they'll tell you this is where the problem is and this is the solution. Sometimes they might not have the resources that is needed. We were talking about this during break where sometimes, scarcity of resources bring up a lot of issues. So give them that chance to come up with solutions. I think that will be very interesting. All right, we have like 6 minutes to go before we end the conversation. I'd love to talk about, but I'll just ask, from you both. We talked about policies, which is a big issue, especially when it comes to like implementation of the same. So then how do we fast track the implementation of some of these policies, and both from the government to also, non-governmental organizations and civil societies, just to make sure that everything works, simultaneously, so that we don't have an area that is lacking and then others is thriving, because at the end of the day we're trying to bridge that gap. So what are some of the things that you would say, some of the areas, especially when it comes to policies, and what we need to do to make sure that everything works simultaneously?
I think, like we said before, we are not short of policies and frameworks, and I always say, if I look at even the disaster management area, Kenya has produced some of the best policies and tools, but these have even been taken by other countries. I lived in South Africa, and I could almost say that, yeah, I could see the Kenya disaster management policy actually being implemented. But we are still even struggling with ours. We haven't even passed it yet. 15, 16 years down the line. So policies we have, but now the question is really how to operationalize it. It's good also to see that now I think there are a lot of efforts and coordination mechanisms that are being put in place to sort of bring all the actors together, and also the different levels of government. So national government, county government, the county governments themselves, even having their own, you know, coordination mechanisms. For example, if it's health, they have their own health committee, and through that, then they're able to see, you know, which are these counties that maybe are lagging behind, or which are these counties that need support. So that coordination, I think, needs to be strengthened. It needs to be enhanced to just ensure that all the players are on the table. But then we need to also then prioritize and allocate the resources, like we said, to be able to implement, because you can have a beautiful policy, but if you don't have the resource to operationalize it, then that's going to be a challenge. So how do we ensure that appropriate resource, you know, enough resources, or at least the basic minimum that is required to operationalize these policies is actually availed and is very well then distributed, because we continue to see, of course, some of the counties that probably would need the most to come to the same level as others are left behind, because then also there's no equitable distribution of resources for them to be able to do what they need to do.
Absolutely. All right.
Yeah, for me, I mean, it's at the end of the day, no matter whether it's in the real world or digital world, it's about priorities. We have to, as a country, say, as a world, we want to prioritize that no one dies giving life in childbirth. We have to say we will not tolerate FGM. We outlaw it and follow up appropriately. We have to say gender-based violence is not okay. It must be eliminated. We have to say that teenage pregnancies are not okay, and they have consequences not only for the individual but also for the entire country and the economy. And if we set all of these priorities, then investments will come, digital solutions will come, the support and the transformation will follow automatically. So priorities is for me the most important, and that is in all spheres, including, of course, when we talk about disasters, in camps, in drought-affected areas, but it's really across the country.
Absolutely. All right, and of course, the biggest you know, aspect of the same is putting in the work, because we can talk about all those things over and over again, but if we do not put in the work, again, we'll come back here next year and still talk about the same issues. So as we bring this to a close, what sort of conversations do you want to have, or actions that you want to see taken in the next few months, maybe in the next few years, 2 years, 3 years, 5 years down the line? What sort of conversations or trajectory, you know, as far as promoting equity and equality is concerned? Where do you want to see us as a country and, you know, across the globe as well? Let me get with you, Dr. Asha.
No, thank you. I think, again, as Anders was saying, it's important that we identify really, you know, what we need to work on, so that then we sort of, you know, consolidate, and I don't want to talk about mass action now. It's not maybe the right term to use today, but
context,
it's almost like you need, you know, that kind of push to have everyone then concentrate on those key priorities that we are talking about. Because if we continue to also just act on them, this, you know, Kenya Red Cross decides this is important, UNFPA decides this is important,
and like we're sticking to our lane.
Exactly. So we will never really give it that kind of push to really get it to where it is. So I think we just need to come together and identify that, and then be able to say, okay, we have many other issues that we are dealing with, but what are these 2-3 things as a country we really want to deal with in terms of gender equity and all that, and then we all work towards it.
Okay, and speaking to the people, I just want you to look at that camera and your camera and speak to the people. Really, as far as this whole question about equity and equality is concerned, so that we do not also have like push and pulls between where are you talking about the girls alone, where is the boy child, how do we involve them, you know, all together. Very quickly, like 30 seconds before we go to Mr. Andrews.
I think for me it's just to say that we've come a long way, that we have to appreciate, but to say that yes, we still have a long way to go, but that each and every one of us can actually make a contribution from wherever we are. It doesn't matter how small, how low. It's important that we all focus on actually contributing to this, and it can be done. So I think it's just to focus, make it a priority. It's not only about women and girls. We've talked about the men as well, even in disasters, but also to say that even for women and girls, we need the men on board.
True.
So again, the concept of he for she is really critical,
really,
that
really
we need
strong.
more he's to
Yeah.
actually come on board.
I like that. I like that. All right, Mr. Anders, conversations that you want to
Yes,
see
absolutely.
actually want to
I would say, I mean, we need to see Kenya and Kenyans leading from the front,
right.
as Kenyans have been doing up till now, to make sure that nobody dies giving birth, nobody is subjected to gender-based violence, nobody has to undergo FGM and so on and so forth. And this can only be done at the community level. That's really it starts with investments from us, with investments from Kenya Red Cross, government, working together. But we can actually do it. And I think Kenyans need to be proud of the fact that you have achieved so much, and you need to continue to lead from the front.
Absolutely. Take the battle from the front. I like that. Thank you very much, Mr. Anders Thompson, UNFPA country representative right here in the country. Of course, Dr. Asha Mohammed, Secretary General, Kenya Red Cross Society. Thank you so much both for coming by
Thank
today.
you very much.
And we hope that we'll also have you in the next few months or next year, so that we see, is there a difference in terms of the action, right?
There will be.
Hopefully there will be. And I like your optimism, so that we see some of the gaps and what more